My name is Dr. Chandrashekar Janakiram. It's a big name. You can call me Chandra. And I serve as a director for Amrita Center for Evidence-Based Oral Health, a JBA Center for Excellence. And also I am a faculty as a professor and head of the Department of Public Health Dentistry in School of Dentistry. I have been involved in JBI from last 4 years when I took my official training, comprehensive systematic review training program in 2020. And I looked everywhere and I found that JBI was having some methodology for doing this evidence synthesis. So that's how the interest came into the evidence synthesis and in JBI. As a JBI director, I feel that we could do a lot of things especially in promoting the JBI methodology in this part of the world. And I feel that it is a fulfilling role for me that when we started our journey in 15 years back in knowledge translation, evidence synthesis, and becoming a director for the JBI entity is fulfilling and promising role for me, and I'm really happy with that. The most important thing as a director for me is to develop an ecosystem to appreciate and evidence among the healthcare practitioners and use this evidence for the patient improvement in the patient outcomes. And that's where I feel that, the end user should be a patient benefit and improve the policies and improve the health outcomes. JBI approach is very important. When we applied this JBI qualitative synthesis, and it really helped us in transforming the policy and improving the patient outcomes in an indigenous population. We have in a team which is a varied skill sets. And through the interdisciplinary meetings, transparent communication, and shared decision process, we try to collaborate and achieve the goals there. So what we try to do is we leverage on each member's expertise, actively engage them with the community partners to ensure that our strategies are innovative and practically relevant. And I feel that one of the greatest success for us is developing a conference, a JBI Colloquium conference thing that is a diversity in healthcare and unity in evidence. I feel that that's a greatest collaborative effort in developing a conference scene, and really it's need of the hour for our in this situation actually. The impact of JBIC has been very transformative in our settings, in the appreciation of evidence for the practice. People were just thinking that a review is just you can sit in one place and complete in few days' time. When they know the value of evidence generation, what is that evidence means? Evidence means it's some sort of a belief in that particular information what we have generated. So that belief has increased because the JBIC has developed those different methodologies and how it has really transformative in our approach to the practice. Then being a part of JBI is inspiring and fulfilling. It is incredibly empowering to work in an environment. It is an evidence-based innovation at the forefront, or we are able to make some changes in their way of thinking to apply how they practice in an evidence-based form. So that's where it's been a fulfilling role for me.